My husband was a Rotarian for many years through the Salvation Army, so I even know the Rotary song. So, but I just want to say thank you. I'm just going to go to the share screen, and so you'll be able to see my presentation here, and everybody can see it okay?
Good.
Okay. So just to talk to you a little bit about the grant that the Salvation Army and other organizations have received through Agriculture Canada for food security in Canada. I'm just going to ask you if you wouldn't mind to put your computers on mute because I don't want any background noises, and I'm also going to just open it up for questions at the end of the presentation. So if you would please whoever did that.
You're ready to go now.
Okay, and there's a couple of things. I'm going to talk about a Salvation Army unit. When I say a Salvation Army unit, what I mean is the local branch of the Salvation Army. So just so that you know when I say that's what I'm talking about. So today I want to talk about 4 issues concerning food security. Why has food security come to the forefront as such an important issue during COVID? The federal government's emergency response to food insecurity and inequalities, the Salvation Army's response to alleviate food insecurity and inequalities, and the way forward. How can we find real solutions and real permanent solutions? So the obvious answer why food insecurity has become such an important issue during this crisis is because, well, in a crisis, people need a helping hand. Lost jobs, lost jobs, low income, lost income. This all leads to a loss of basic necessities such as food and housing. So the government quickly realized that the CERB amount that was provided would not be enough for some people. And some food banks had to begin closing their doors at the beginning of the pandemic because we just were not equipped to deal with the issue of the pandemic. So, and also the fact that many food banks use volunteers as their main human resource force, and we were not able to continue using those volunteers because they were seniors and they weren't allowed to go and work with us. So that's 2 of the reasons why it became such an important thing, but also it's known that the people in poverty were the hardest hit by COVID-19. This is true in terms of the virus itself, people getting sick, but also because of the quarantine orders. So all of the supports that are normally in place for these groups of people had to close down because of COVID-19. So some people had no access to internet, no meal services, no housing support, no respite care, no support groups. None of those things could operate during the close down. And the only things that could remain open really were food banks and shelters. And they don't meet all of the needs. So the people in poverty were really hard hit by COVID and still are. The Human Rights Commission even commissioned a statement outlining how vulnerable people are even more vulnerable at this time. And you can go find that statement on their website called Inequality Amplified by the COVID-19 Crisis. And then there's the human need perception, and we'll talk a little bit more about that in a minute. But just wanted to mention that food insecurity in Canada is not really from a lack of food. We have enough food. It's from a lack of food accessibility. People who, for various reasons, are unable to provide for their families they're unable to provide nutritious meals or even meals at all. I'm just trying to get my screen here. So I'm sure you've all seen this Maslow's hierarchy of needs before. This graphic shows that during a time of distress, which we've all been living in, we concentrate on our basic physical needs. And that's why during this COVID crisis, food security has become such an important issue, because it's a basic need that needs to be met during a time of crisis. I don't know if you remember that during the beginning of the pandemic, how everyone was so fearful they would run out of toilet paper. Well, that's because during a time of crisis, we're just focused on those basic needs, and often we really don't know what to do. We just know we have to do something. So for some people, it was run out and buy some toilet paper, because that's going to meet our basic need. Organizations were chosen by Agriculture Canada for their national presence. So those were the chosen charities to receive the funding, because they could reach all the corners of Canada, including Indigenous people and Northern populations. The Salvation Army was chosen because we are a national agency, and all of the data collected across Canada is collated into one report for Agriculture Canada. It is our responsibility to work with local partners to meet the urgent food needs of Canadians. The services extend beyond their normal networks to reach all Canadians as widely as possible. The face of the client has changed dramatically during the crisis to include those who have reduced income or who have completely lost their income. So we saw people who we wouldn't normally access a food bank come to our food banks, people who have homes, people who have good jobs, but they've lost their job and they're just not able at this time to make ends meet. So the funds can be used to purchase a variety of things. There's food, we can buy or rent equipment that we need. We can access new distribution centers, so open up a new center if we feel there's a need. We can hire temporary help to fill those volunteer shortages. And we can also implement biosecurity measures. So our whole way of working needed to change to meet those, the COVID restrictions. The government had, like I said, some important reporting expectations. We were required to submit a report to the funder on performance measures. We need to regularly input the data into our regular database. So not only did the food banks have a greater demand for service, they also had more stringent reporting procedures put into place. So it was a big demand, a heavy ask for our workers. After the pandemic, there will be a staff survey that the government is asking for to gather the feedback and perceptions from staff on COVID-19 the impact to our services, how this funding has influenced our services, and each unit will be required to answer questions on the impact, the capacity, how the funding has made a difference, and about food insecurity in each community. And then also, clients will be asked to do a survey to talk about the quality of the food basket they received, the nutrition level, and their satisfaction with the service that they received. So I just wanted to talk a little bit more about the Salvation Army's response to COVID-19 and what our food banks have done in the division in Quebec specifically. So on April 8th, the Salvation Army received a generous donation of $5 million from the government to ensure that food security measures were put in place. Of that $5 million, almost $200,000 was designated for Quebec. So starting April 20th, and each week thereafter, the food bank was required to file a report to the government of how many people we served, how many pounds of food we gave out. We were also required to report exactly what the funds were used for, with a weekly tally of the money spent. very strict criteria what the funds could be used for. It must be COVID related, and it must help the most vulnerable. Organizations applied for a second wave of funding, and the community organizations that were able to meet the criteria were accepted. In part because of our centralized database and our ability to bring all the data together in one report, the Salvation Army was accepted for the second wave. Our food banks have stayed open all during the lockdown and have been able to quickly adapt the services and keep the staff and clients healthy at the same time. So the government requires a very strict accounting for the funding received, but the Salvation Army tried to make this reporting as simple as possible for our units through an online form. I'm not going to go all through the form for you, but I just wanted to show you that we were able to help the units by making a very simple reporting process for them. So each week, every Friday, they got a reminder that they needed to fill out the form. They provided the administer unit information, the contact information, the basic information, address, phone number. All of this was populated for them. But the government also wanted us to concentrate on community partners, creating partnerships, finding new partnerships, and we've been able to do some of that here in Quebec. Then we had to talk about the funding received, what funding had been used, what it had been used for, the value of the food that we've purchased, the value of the equipment that we've purchased. We were also able to provide gift cards if necessary. For some people, it was just easier to give a grocery gift card rather than give groceries, those with reduced mobility, senior people, people that couldn't come to the food bank themselves. So that was a good solution for some people. We needed to report the weight of the food distributed, the number of households served, and the number of meals that we provided. Then we were also given the opportunity to talk about what other needs we had, what gaps in service we were seeing, and also the additional funding that we would require to meet those gaps in the service. They also asked us to talk a little bit about the impact of the funding on the service that we were providing, and any other comments that we had. And then each report, we had to give them a summary. So the amount that was used this time period, this week, and then the funding that we had left to spend from the funding that we received from the government. So it was a quite detailed reporting process, but it's worked well for us so far. We're just in the beginning of the second stage funding. So we've been able to, I think the government's been pleased with what the Salvation Army's been able to provide them. So on June 11th, we did receive that second wave of funding. We received at that point $6,125,000 for Canada, and $346,000 of that came here to Quebec to help our food banks and our shelters here in Quebec. So between May 1st and July 10th, the Salvation Army in Quebec has provided 41,941 meals. Just to throw some numbers at you, 455,233 pounds of food has been distributed, and 5,600 households have been served throughout the province of Quebec through the Salvation Army. So here in Quebec, we distributed the funds to 6 of our food banks and 2 of the shelters. So L'Abri de l'Espoir here in Montreal, which is a women's shelter, received some funding, and also the Booth Center here in Montreal received some of the funding, and then 6 of our food banks distributed throughout the province received the funding. In Sherbrooke, you see a picture there of a client ready to come and pick up his food bank, or his food basket. They have a frozen meal program in Sherbrooke as well that they were able to continue. So people could come and pick up a ready-made meal as well as a food basket. So we had to change the way of providing service. In St. Jerome, we provide a soup kitchen normally. The soup kitchen would feed about 450 men every day a hot breakfast. But now we're not able to do that, of course. So the staff and volunteer prepare the meals. They put the meals on this table here, and the men come and pick up their meals and take them out and take them home or to the park or wherever they want to go to eat their meal. Most of the men using this service rent rooms, so they don't have kitchen facilities, so they really rely on these meals. So it was important that we continue the service. Here you'll see the volunteers at the South Shore Food Bank here in Montreal. We changed the way that we did food delivery in Montreal as well. Here on the South Shore, they did a lot of delivery of the baskets to homes because people were just not able to get out. The elderly couldn't go out. People with small children had the children at home. It just made it very difficult for them to go pick up the baskets. So we decided that we would be delivering the baskets when necessary. So the sick and the disabled all receive their baskets at home. And normally each month a family in need would meet a worker and provide some evidence of need. So we were of course unable to meet face-to-face during this time. So short interviews were done by the telephone, and the client was given a specific time to come and pick up their food, and the food was placed in the foyer or outside the building in order to have no contact service. So these are some of the volunteers at the South Shore Salvation Army Food Bank. Many community partnerships have been started or improved upon. In this picture, you'll see a group of volunteers in Quebec City that are part of the Katmavik program, volunteer program. I'm sure you've heard of that volunteer program. So they were able to help in the food bank in Quebec City. And the Rotary Club in Quebec City is very involved with the food bank. That some of their members go and volunteer, and they also provide financial support through the Rotary Bingo. So in that picture, you'll see a formal check presentation during the time of COVID at the Salvation Army in Quebec City. The Monk Street the Monk Boulevard Center, the Family Services or the Food Bank took over the whole building. They had a huge increase in services. The number of people they served more than doubled. And normally our food banks don't have the resources to supplement what is donated. But because of the federal grant, we were able to buy food to give. Usually our food banks exist on donations, food that is donated either through Moisson Montréal or through other sources. But during COVID, we were able to buy food to make a better quality basket, and the clients are very grateful. Just some of the things that we heard back is that they were able to buy meat, which they aren't able to give in the baskets very often, and good quality fruit and vegetables. They said that some families, due to illness, couldn't come and pick up their baskets, so they were able to provide that delivery service. One of the workers writes and says, so I received a message from my workers saying that we were running out of food and we didn't have enough food for the afternoon. And he said, thankfully, I was able to make an order of food right away. The food got delivered right that day, and they were able to meet the demand. But it just goes to show you that we had to learn to be very flexible and to meet the higher demand and do it in with all the restrictions in place. So the grant has allowed us to improve what supplies we would give to the supplies that we give to the clients. We now are able to provide more variety for the clients and a healthier food basket. So this is at the Booth Center in Montreal. We have the 2 shelters, and the dining rooms, of course, could not be used during the pandemic. And in fact, they're still not being used at this point. So the food had to be delivered to the rooms. So volunteers had to be found to deliver food to the rooms. 3 meals a day are delivered to the residents. So that was quite an undertaking, especially for the Booth Center, who has, I think it's around 200 clients. So all of that food needed to be delivered every day since April 8th, I believe, that they're delivering food 3 times a day to the residents. So just in conclusion, I just want to talk about where do we go from here? Is food insecurity just a COVID-related problem? Well, we know that the underlying cause of food insecurity is financial constraints, not having enough food, money to pay for food. Almost 2/3 of the food insecure households in Canada are the working poor. Houses with low wages, self-employed, or part-time work and precarious work. It is a serious problem in Canada that impacts physical, mental, and social health, and costs our healthcare system considerably. 1 in 8 households in Canada is food insecure, including over 1 million children living in homes that struggle to put food on the table. 5 characteristics are most strongly associated with food insecurity: low levels of education, weak social networks, which means that the person finds it difficult to make new friends, or has what we say burnt bridges and can't make new friends, and they don't have any social network. Limited social capital. It could mean that the friends and family they do have are unable to help them in their time of need. Low household income, and of course being unemployed. All things that contribute to food insecurity. Food banks are good in an emergency. They help people stay fed. They enable people to use that grocery money to pay rent or a mortgage. But a guaranteed implement supplement would be a better solution. It's a temporary solution to enable those living below the poverty line to meet their basic needs and achieve a certain amount of security and stability. And then there's the rent supplements. My personal opinion is that low-income housing is not the solution. Rent supplements are more of a solution. Low-income housing, you get, I hate to use the word, but a ghetto formed, because you have all of the low-income housing, substandardized housing, and there's a stigma attached to the low-income housing. For me, a better solution is rent supplements, which enable people to live in privately owned apartments, and they are given a rent supplement to help them pay the rent for that privately owned apartment. There's no stigma attached to that, and they also are able to live amongst the general population and hopefully provide more, find more adequate housing. But there's also another thing I wanted to talk about today, and that's investment in projects such as Pathway of Hope. There's many organizations doing good work right now to help deal with some of the fundamental issues of poverty. And Pathway of Hope is just one of those issues. And I have a video that I wanted to show you. So I just have to go out for a minute and go and put my speaker on for you so that you can hear. Sorry, this is just going to take 1 second. I just have to go back here, because I don't think the sound is working on that. Okay, here we go.
We were scared that we were going to be living out of our truck for a while.
It was a hard time. I literally lived in a house with no running water and
We
no
can't see
heat.
the video, Barbara. We can hear the sound, but not the video.
Oh, sorry.
Let's try and start it over.
Yeah.
You might have
Okay.
to change the screen that you're sharing. If you have it playing on in another screen, then maybe share that one.
Yeah. Just a sec. Just let me go back here.
Actually, stop sharing that screen and then start all over, I think.
Okay, let me know if this helps. Oops, go back here. That better? No?
We were scared that we were
I
going
think
to.
you have to stop your
Okay.
share. You have to stop your share screening completely.
Okay,
We're still getting your main page. That's it. And now share
now go
your.
back again. Okay.
Yeah, I think that should do it. The way we tried it earlier. There we go.
Truck for a while.
Good.
It was a hard time. I literally lived in a house with no running water and no heat.
That's what we were looking at is, well, I hope tomorrow I have a roof. I hope tomorrow I have food.
I lost my job. And right after that, I found out I had Lyme disease.
We knew we had a child on the way. We didn't know how things were going to go.
Now I'm a mom and I have to figure out how to pay bills and find a house to put my child in and provide food for her.
I was trying anything to get even a minimum wage job. I just needed something. And you can't just survive for yourself, because if it would have been me, I would have chose not to.
So then we went back homeless, living in a family shelter.
I was completely convinced that it was a cycle that was never going to end.
You're hopeless.
Pathway of Hope is an important shift in how the Salvation Army provides services to people seeking help and hope.
It gives them a little bit of guidance where maybe they've sat down in their life and decided they just didn't know what to do.
Nancy was there, and she has been a huge guiding point.
Nobody had been willing to help us without getting something in return.
It's not easy for people to ask for help.
We all fall down, but this is how you get up. There's no shame in falling down. The shame is staying down there.
To finally have somebody who was willing to give us a break.
The Salvation Army has always tried to look at the
Oh,
whole person.
we're having issues here.
That's what we were looking at is, well, I hope tomorrow I have a roof. I hope tomorrow I have
We
food.
were a little bit
I
farther
lost
than
my
that.
job. And right after that, I found out I had Lyme disease.
We knew we had finally somebody who was willing to give us a break.
The Salvation Army has always tried to look at the whole person.
Mind, body, soul, spiritually. Vital to the process is the relationship. We see the potential in them. We see what they can be.
The Pathway of Hope helps them set up goals, and then we work as a team to provide the necessary actions to accomplish that goal.
Each step is really customizable based on the needs of the family who comes to us.
Calling a doctor's office, getting your prescription done. How do I do my taxes? Here. This is the skill that you need right now. It's available. Just come take it. You have resources that you can tap into to get your needs met.
Within an hour's time, we had the cover letter, the resume, all sent in. I got back to the house in time for the phone interview.
God has a plan for each one of us. Sometimes we can't see it.
She pulled me out with these baby steps, and then I began to start seeing, oh,
It's not a doing for you, it's a doing with you. If they allow us to come alongside them, they will begin to experience a transformation that they didn't think they were, one, deserving of, but also capable of.
You're not just teaching somebody how to budget their money. There is far more going on than what you can see on a budget sheet.
It's a blessing to see them grow from feeling helpless to feeling self-confident.
It's about restoring dignity.
The last crisis that hit, I was so proud to go to Nancy and say, this is what I did. And she said, I am so proud of you.
I feel honored to be her mentor and to help make a difference in her life.
We have the tools now that we need to figure out how to be able to push on.
It's going to help a lot of people.
We're going to see lives transformed for the good and to the glory of God.
I love you, Mom.
I love you too, baby.
So I just wanted to talk a little bit about that program, Pathway of Hope. We talked a bit at the beginning about the physiological needs and how when people are in distress, that's what we concentrate on. People living in poverty, they live there. They live in that time of distress. And so they can never move up that ladder of human need. So they live and they survive but they don't thrive, because they're always concentrated on meeting those physical needs. So through this program, Pathway of Hope, what we want to do is we want to be able to meet those basic and give them those tools that they need to help them move forward. Funders and clients, myself, we're tired of publicizing. This is how many people we serve. This is how many baskets of food we gave out, because it seems like the problem is never solved. Funders now want to know, what impact are you having on the lives of the people you're serving? What transformation is actually taking place in those lives? So the Salvation Army developed this program to help break the cycle of poverty. Programs like Pathway of Hope help get people out of poverty into a more satisfying life. So this program has been implemented in the States and in some provinces in Canada, and now we're ready in Quebec to begin implementing this program. It won't be a large number of people because we have limited resources, so we will probably choose people will choose themselves for this program. It has to be voluntary, but and they will decide that they want to follow this program, and they're given a caseworker who does intensive casework with them to give them the tools that they need to move forward with their lives. So just in conclusion, I just want to say thank you. I want to say thank you to the Government of Canada actually for stepping up and helping organizations like the Salvation Army to be able to continue to provide services through the pandemic. It's been we wouldn't have been able to do it without the grant from the government. I would also like to say thanks to those on the front lines, some of the workers, healthcare workers, but also those workers in our food banks. They put their own lives at risk really to continue the service. So, thanks needs to be given to them and the shelter workers. And I want to say thank you to you today for the opportunity for sharing and for listening to this presentation. Take care.
Thank you very much, Barbara.
Any questions?
I'm going to start off with one question and let everybody else jump in, and we'll unmute it. We'll unmute it.
Yeah, we can unmute the.
Yeah. My first question is, so there was $5 million that was given to the Salvation Army for Canada, and Quebec got $200,000, which is 0.05% of the money that was given out. How does that happen?
Well, I have my answer, and I don't know if Glenn can answer that question better than I can, but probably it's because the Salvation Army services in Quebec compared to the services provided outside of Quebec is very small. We do very little work in the Salvation Army here in Quebec compared to the other provinces. And maybe Glenn, you want to speak to that as well.
Yeah, it's basically, the allocation was based on capacity to use the money to meet the reporting requirements of Agri-Canada and to do it quickly enough. The Salvation Army in Quebec represents about 2% of Salvation Army's overall activity in Canada. We receive 4% of the funds, 200,000 out of 5 million. And in the second pass, I think we received about 5%. So that would be the sort of the corporate argument, Jim. It's not sufficient to meet the needs in Quebec. It's not proportional in that sense, but it's tied really to just organizational capacity.
Interesting. I didn't realize that the organization was much smaller in Quebec than elsewhere.
Yeah.
Considerably smaller. I think there's around 300 food banks, if I'm not mistaken, in Canada, and we have 6 of them here in Quebec.
Yeah.
So
2%.
Okay. Anybody else? Questions? It's open.
Well, does that mean that Quebec food banks in Quebec are relatively underserved, or just a proportion that is run by the Salvation Army?
It's the number of our capacity to meet the need here is smaller. We just don't have the people that can work in French. Number one, we don't have the capacity to meet the need. There are a lot of food banks that are meeting the need here in Quebec. We have a number of food banks in each city. So the Salvation Army provides a portion of that, the service, but not the whole service for each city, for sure.
So the government would be giving money also to the other agencies, possibly?
That's correct.
Okay.
The federal government for COVID was only given, as far as I know, to those 5 organizations because of our national capacity. And then those 5 organizations, if an organization in a certain city had a need, they were to ask one of those 5 organizations to help them out. So the funding that we received in the Salvation Army, if a food bank here in Quebec, for example, needed help, but they didn't receive the government funding, they could come to one of those 5 organizations and say, can you help us out by providing some funds to us?
I think the smart thing was the government actually acknowledging that the way to do this was to use organizations that were already on the ground and could deliver quickly and properly.
Yeah, for sure.
You made a comment earlier, Barbara, about rather than having low rent housing, better to have rent subsidies. How do you feel in general about the idea of a minimum annual income federally?
I think the minimum annual income is a great stopgap solution. I don't think it should be a permanent solution, but I think it should be a temporary solution to help people move forward. Give them that security, give them that sense of safety they need to move forward with their lives. But let me retract a little bit. For some people, it will be a permanent solution. But for other people, it only needs to be a temporary solution so that they can find other resources to help them live.
You feel that there's a possibility with a minimum income that people will simply learn to rely on that and not try to improve? Is that an issue?
For sure, there's that possibility. But I think I believe that we see that people that are feeling safe and secure and don't have to worry about where their next meal is coming from can move forward with their lives. As long as you're stuck in that space where you're saying, where am I going to live? What am I going to feed my children? You can't move forward. So I think that it enables them at least to move forward. Not everybody is motivated, and some people need the motivation, but I believe that once people are in that space, that they can actually and will want to move forward. Yeah, the motivation will come.
Anybody else? Okay, on that then, listen, Barbara, I'd like to thank you very much. For me, anyway, one of the things that comes out of this is recognizing that the Salvation Army and all of the different agencies and shelters and everything else throughout Quebec and Canada are not one-trick ponies.
That's right.
It's not just a question of we have this shelter down here and we take care of this or we do that. And I think what is happening, if I'm not mistaken, there's more and more involvement with the government. There's more and more flow between the government and the agencies and trying to work on longer term solutions. What's going on right now is obviously a short-term solution because of the COVID incidents. But just know, like for the now I've forgotten the damn name, the Pathway of Hope is something that it goes above and beyond, and it's trying to take these people and take them out of the situation that they're in, and like let them fly, as it were, to try and change the situation on a permanent basis for as many people as possible. And I think that's really important.
Exactly right. And part of the Pathway of Hope program is, like, as you said, creating those community partnerships, knowing that we can't do it all. We can maybe give some food, but we don't have expertise in perhaps helping people find a job. So we would refer them to that person that can help them find a job. So creating those partnerships is very important.
Well, once again, I thank you very much.
Thank you.
We hope to hear from you